This is Tanya Stansel with Health Education Services. We're going to be discussing heart disease. First, please click subscribe, like, and comment below. First, a disclaimer. This video is for educational purposes only. It is not meant to diagnose or treat any condition. The term heart disease is used when describing several conditions. Types of heart disease include arrhythmia, an irregular heart rhythm, atherosclerosis, hardening of arteries, cardiomyopathy, a condition that leads to the hardening and weakening of heart muscles, congenital heart defects, irregularities that someone is born with, coronary artery disease, a buildup of plaque in arteries, heart infections caused by bacteria, viruses, or parasites, heart valve disease, where damaged valves lead to narrowing, leaking, or improperly closing, myocardial infarctions or a heart attack, the flow of the blood to the heart is disrupted, congestive heart disease, the heart's ability to pump is diminished. Fatigue is a symptom that crosses most types of heart disease. You will notice that is listed as a symptom for each of these types of heart disease. Swollen extremities and changes in heart rate, either faster, slower, or irregular, are also common among types of heart disease. Risk factors for heart disease include age, with the risk of heart disease increasing with age. Sex. Although there is a greater risk generally among men, the risk for women at heart disease increases after menopause. Family history. Having a family member with heart disease increases an individual's personal risk for heart disease. Smoking. Both nicotine and carbon monoxide damage blood vessels. Poor diet. Having a diet high in fat, salt, sugar, and cholesterol increases risk. Hypertension. Having uncontrolled hypertension hardens arteries. High cholesterol. Having increased cholesterol levels increases the risk of plaque formation. Diabetes. Both diabetes and heart disease share risk factors. Obesity. Having increased weight increases risk of heart disease. Physical activity. A lack of exercise also increases risk. Stress. Experiencing stress can damage arteries. Poor dental health. If antigens enter the blood from the mouth, they can increase risk of heart disease. Ethnicity. Native Americans have a lower risk of heart disease. In order to diagnose heart disease, a combination of a physical exam, blood tests, non-invasive tests, and invasive tests should be completed. During the physical exam, both a family history and a personal history should be completed. Blood tests that can be done to help diagnose heart disease include cholesterol levels, high sensitivity C-reactive protein, which is a test for inflammation, lipoprotein A, which is a type of cholesterol determined by genes, brain natriuretic peptide, which is a protein made by the heart and blood vessels. More of this is released when the heart is damaged. Troponin T is a protein in heart muscle. Increased levels are associated with increased risk. Non-invasive tests that can be used to help diagnose heart disease include electrocardiogram, or an EKG, which records electrical signals from the heart, Holter monitoring, which records the heart rhythm for 24 to 72 hours, echocardiogram, creates an image of the heart using sound waves. A stress test tests the heart's response to exercise or medications. Cardiac computerized tomography uses X-rays to create a series of images of the heart. Cardiac magnetic resonance imaging, or MRI, where radio waves create a series of images of the heart. Carotid ultrasound. This provides imaging of the carotid arteries. Invasive tests that may be used in diagnosing heart disease include cardiac catheterization, where a sheath is inserted in a vein or artery either in the groin or the arm and is guided by X-ray to the heart, where pressure can be measured and dye can be injected to help view blood flow, blood vessels, and valves. Electrophysiology study, where a catheter is used to attach electrodes to the heart in order to send electric pulses and to record the heart's responses. The treatment of heart disease depends on the type of heart disease and the severity of the heart disease. Treatments fall into three categories: lifestyle changes, medications, and surgery. Lifestyle changes include a diet rich in fruits and vegetables, managing stress, controlling diabetes, exercising, tobacco cessation, decreasing alcohol consumption, and maintaining a healthy weight. Medications that may be used in treatment include anticoagulants or blood thinners, which prevent blood clots, antiplatelet therapies, which also prevent blood clots, angiotensin-converting enzyme inhibitors, which cause blood vessels to expand, lowering blood pressure, angiotensin II receptor blockers, which control blood pressure, angiotensin receptor neprilysin inhibitors, open narrowed arteries, beta blockers decrease heart rate and blood pressure, and also treat arrhythmias and angina. Calcium channel blockers decrease blood pressure and prevent arrhythmias through relaxing the blood vessels. Cholesterol-lowering medications help to decrease cholesterol levels. Digitalis increases the heart's ability to pump. Diuretics remove water in order to decrease a heart's workload. Vasodilators decrease blood pressure by relaxing blood vessels. Antiarrhythmics treat irregular heart rhythms. Nitrates treat angina and chest pain due to blocked blood vessels. Surgeries that may be used to treat heart disease include coronary artery bypass surgery, where a healthy blood vessel is used to repair a blocked blood vessel, valve replacement or repair, where a valve that is improperly functioning is replaced and or repaired, device implantation, where devices such as a balloon catheter or pacemaker are implanted. Thank you for watching our video. Make sure to click like and subscribe below, and please leave comments.